I didn't have to be here today, standing in front of the United Healthcare's national headquarters. But our organization takes its mission to support patients with Crohn's disease and ulcerative colitis very seriously. And this is where I need to be today. Starting tomorrow, United Healthcare will implement additional obstacles to hinder IBD patients in accessing critical care required to effectively manage their disease. As of June 1st, patients will need to receive prior authorizations for most physician-prescribed endoscopies and colonoscopies procedures. This requirement could disrupt time-sensitive care for millions of patients and create needless anxiety and delay for the patient community. We have asked United Healthcare to please reconsider this course of action. Over 4,000 of our volunteers and people from other organizations around the country have written letters to United Healthcare CEO, Andrew Witty, asking him not to do this. But the clock is ticking, and United Healthcare has refused to even delay this decision. And more importantly, they haven't worked with us to understand the physician and patient needs here. So today, I'm proud to be here with you to stand up for patients confronting a company with $66 billion in cash flow and double-digit growth in the last year. Patients don't measure results in dollars. For them, the results are around invaluable impact of their treatment that adds precious years to their lives. Results mean obtaining quality of life that enables them to actively participate in their community and pursue meaningful work and school, and experience the joy of being engaged with their friends and family. Results mean relief from the dilemma of having to choose between the financial burden of healthcare and feeding their families. Advocating on behalf of our patients, we wanted to be sure United Healthcare understand the dramatic impact of their decisions would have on patient care. So today, we have the privilege of having several esteemed speakers share their insights and perspectives. Following their brief comments, will be available for interviews. First, I would like to introduce Amber Bacchus, the incoming chair for the Crohn's and Colitis Foundation and our current chair of our mission committee. Amber?
Great, thank you very much, Laura. Again, my name is Amber Bacchus, B-A-C-K-H-A-U-S, a long-time volunteer with the Crohn's and Colitis Foundation and the incoming chair of its National Board of Trustees. And I would say it's a good morning, except if you are a patient who's covered by United Healthcare insurance, suffering from Crohn's disease, ulcerative colitis, or any other gastrointestinal issue. This decision by United Healthcare to require pre-authorization for most doctor-prescribed, again, doctor-prescribed endoscopies and colonoscopies is anti-patient and anti-consumer. And let's be honest, I don't know of anyone who enjoys getting an endoscopy or a colonoscopy, but for those suffering from IBD, it's a critical tool in managing their diseases. While healthy people might only need this procedure once every 10 years, many Crohn's disease and ulcerative colitis patients must receive these tests yearly, twice a year, or more to determine if their treatments are effective, and if they are not, prescribe a therapy that will lead to remission. Introducing these new barriers to care will result in patients missing tests and having to fight health insurance bureaucracy to receive the medical care their doctor says they need. The Foundation's research has shown that prior authorization only serves to delay care. For example, pediatric IBD patients subjected to insurance-related delays suffered increased disease severity and required more complex medical treatments, including hospitalizations. And physicians report that 92% of patients who are subjected to insurance-related delays in care experience negative health outcomes. This year, approximately 70,000 Americans will be diagnosed with Crohn's disease or ulcerative colitis, joining the 1 in 100 Americans who already have been diagnosed. They will be scared, they will be anxious, they will be in pain. They do not need the people in this building behind me deciding whether or not they need a colonoscopy. That is a decision for their doctor to make. The Crohn's and Colitis Foundation is dedicated to finding cures for Crohn's disease and ulcerative colitis and improving the lives of children and adults living with those diseases. And that includes ensuring they have access to the care they need in a timely manner when their doctor prescribes it. And with that, I'd like to turn it over to my fellow Minnesotan and a Crohn's patient, Haley Mills. Thank you.
Thank you, Amber. My name is Haley Mills, HALEYMILLS, and for the last 18 years, I have been a Crohn's disease patient. It took almost 6 months to get a diagnosis. There were blood tests, stool samples, and many different medicines that were tried, but I didn't have any answers until I got a colonoscopy and an endoscopy. Over the years, I've had 20 surgeries and spent large chunks of my life in the hospital due to flare-ups and complications from my illness. I've missed holidays, weddings, and important days with my friends and my family. There are long wait times to get in with GI providers because ulcerative colitis and Crohn's disease are unfortunately so prevalent. When I'm able to get into a provider, any delays from insurance companies for medications, colonoscopies, and endoscopies can mean the difference in ending up at the hospital or being able to heal at home. I'm really concerned that this new policy could mean significant delays in getting the colonoscopy I need in order to make a treatment decision, leading to rounds and rounds of appeals and ultimately worse outcomes for my disease. I'd like to introduce Dr. Daniel Pombianco, president of the American College of Gastroenterology. He's a gastroenterologist practicing in Charlottesville, Virginia, and is here to show ACG's support for the foundation and our patient advocates today. Thank you.
Thanks, Haley. I'm Dr. Daniel Pombianco, P-A-M-B-I-A-N-C-O, very phonetic. I want to, first of all, thank you all for inviting me here. This is an honor to be here and be with patient advocacy groups, and there's no better coalition than doctors and patients together. And so this is a sentinel moment for me. So I am here representing the American College of Gastroenterology and my patients. I'm a practicing gastroenterologist in Charlottesville, Virginia. The ACG and the GI societies have had multiple meetings with United Healthcare to express our fear and concerns for these new changes that will have an impact on patient care. Each meeting left us more confused and frustrated than the prior one. This program is not only bad for patients, there are so many operational challenges that this creates that have been unanswered. What that means is that my staff will be spending more time trying to get pre-authorizations. I will be spending more time on the phone getting peer-to-peer reviews, that I'd be able to see more patients and have easier access to care. So this will only leave us struggling, not improving our access to care or patient care. Many of my IBD patients will now have to receive prior approval for routine surveillance colonoscopy, or if patients are experiencing symptoms and need a diagnostic colonoscopy. The ACG clinical guidelines clearly state that a colonoscopy is appropriate and is the standard of care. A word on guidelines. Guidelines are made to be not broken, but they're a bumper, they're a guideline, they're not a dictum. So this idea that if we're not following the precision of guidelines is actually not good clinical care. In the manner of shared decision making, that shared decision making means that what is most appropriate for my individual patient, that may not fit that guideline. So that's an important point that I want to make here today. So, yet, United will require pre-approval despite claiming that this program is to ensure that providers are following these guidelines. And in essence, this is practicing medicine without a medical license. Prior authorization leads to poor outcomes and serious adverse events amongst patients. This is known. This is in the literature. Prior authorization leads to physician burnout and serious workforce challenges amongst practices, requires more staff. It increases the cost of care for my practice. The data is even unclear as to whether prior authorization actually saves healthcare system money. So we say enough is enough. And on that note, United needs to reconsider and reverse its course. Hopefully our presence here this morning will provide the necessary alarm bell, and this will be heeded. So thank you once again for inviting and the opportunity to speak here and be here with you today. So with that said, I would like to introduce Chris Evans, who is the president of the Colon Cancer Coalition. Chris?
Chris Evans, CHRIS, EVANS. Good morning. My name is Chris Evans. I'm president of the Colon Cancer Coalition and Get Your Rearing events nationwide. Our mission is to get people screened for colorectal cancer because we know that screening is the answer to preventing life-threatening and changing late diagnosis of colorectal cancer. Often those who are diagnosed with colorectal cancer have experienced no signs or symptoms, so monitoring is very important for polyps. 50,000 die annually from the disease, permanently altering families, friends, and workplaces. By 2030, colorectal cancer will be the leading cause of cancer deaths in people under 50. When diagnosed in early stages, colorectal cancer survival is 90%, compared to late stage, which drops to 14% when symptoms often begin to manifest. So, sobering facts. How do we prevent this? On time and regular screening. Per the American Cancer Society, 1/3 of physicians have reported that delays caused by prior authorization policies led to delayed identification and treatment of cancer. This is an unacceptable toll. The decision by United Healthcare to implement the barrier of prior authorization for a colonoscopy will delay or worse stop screening for many, especially in diverse and vulnerable populations. We ask today for United Healthcare to join us in our mission to prevent late-stage colorectal cancer diagnosis and to save lives by reversing the implementation of prior authorization for colonoscopies. I would now like to introduce Alicia Barron, Executive Director of the Infusion Access Foundation.
Thank you, Chris, and thank you to the Crohn's and Colitis Foundation for inviting me to speak today. You're probably wondering why someone from an organization with infusion in their name has been asked to speak, but I promise there is relevance to this. At the Infusion Access Foundation, we work to ensure that people living with chronic illnesses like Crohn's and ulcerative colitis have access to provider-administered medications in a timely and cost-effective manner. While this issue is not specific to infusion medicines, many of our members are living with IBD, and we are gravely concerned about how this additional measure to ration healthcare may affect the more than 3 million people living with IBD. Endoscopies and colonoscopies are currently the best way for our providers to track disease, ensure that these medications are working, and to ensure that their patients are reaching remission. Until new ways are either made more accessible or discovered, this is a vital and irreplaceable part of IBD management. Unnecessary delays in getting treatment and tests for people living with chronic illnesses causes undue stress, possible disease progression, and an increased likelihood of hospitalization. This prior authorization requirement that UHC is implementing is another unnecessary, burdensome, and frankly dangerous way for them to ration healthcare. It is incredibly difficult to get the treatment you and your doctor determine is right for you because of steps like prior authorizations and step therapy. It already requires your doctor's offices to have special staff, as Dr. Pambianco already mentioned, whose sole job is to deal with insurance hurdles. And the reality is that some people that don't have access to these types of systems won't get the care that they need, and their colon cancer will go undiagnosed. And I want to stop and to give you a story real fast. I'm going to take a little bit of liberty here. I want to tell you about a friend of mine named Ben. He has ulcerative colitis, and his colonoscopy was delayed because of COVID. So, understandable delay, but it was delayed because of COVID nonetheless. And when he was finally able to get in to get his colonoscopy, he was diagnosed with stage 4 colon cancer and is now fighting for his life. Let's not have more Bens, please. So I join you in asking United Healthcare to please rethink this dangerous and unnecessary policy and let our expert providers determine what tests and what treatment are best for their patients. I think we can all agree that medical care should be determined by healthcare providers, not by corporations. I'm going to turn it over to Laura.
I want to thank all our speakers today and our advocates for being here and sharing their stories and providing examples of how the soon-to-be implemented policy of prior authorization will hurt the IBD community and others. We're asking United Healthcare not to implement this policy and engage the IBD community, patients, healthcare professionals to create a policy that reflects the needs of the community and evidence-based management of IBD patients. We welcome the opportunity to have a patient-centric policy developed in partnership with United Healthcare. Thank you so much, and we are available for interviews.